Hi, Hannah. Thank you for the blue heart. Hi, Micah. All right. I am finally here. Thank you all. Thank you all for being here. Hi, Tracy. Hi, Miss Ruth. Thank you for the blue heart. Hi, Aurora, Pamela. Oh, I have a full house tonight. Thank you, guys. Hi, Christina, Yvette, and Marissa. Thank you all for joining me. Wow, I think this is the fastest I have ever had people come in. This is awesome. Thank you guys so much. It's been a very busy day today, so but I'm here. And I'm ready to chit chat with all of you. Hi, Isabel. Hi, Regina. Hi, Hannah. Hi, Simone. Thank you all for all the blue hearts. All right, so if you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Tonight I am talking about a few things. All right, so I got a letter. Well, it's actually a comment, but it was a really good, very well written comment. So I was like, okay, this is perfect for inspiration for tonight's episode. Medical coding certification or degree, right? And also talking about MUEs or medically unlikely edits. All right. Hi, Dorothy. Hi, Ellie. Thank you for the blue hearts. All right, so I'm going to go ahead and read the comment, and then we will talk about it. Okay, so here we go. She says, hi, Blue. I had a question. So I've been doing a lot of job searches for remote medical coders, and often the job requirements will say RHIA, RHIT, or CCS certified. Does that often mean that RHIA, or Registered Health Information Administrator, okay, will get paid more for the job? Or does this basically mean that you have a degree, but it basically doesn't mean much because you could get the same pay as someone with a CCS certification? I'm trying to decide whether it would be worth the extra effort to get the RHIA, or if it would be a waste of money. I heard that the RHIT will be phasing out in 2027. I'm not sure if that's accurate or not. I basically want to do remote coding and maybe auditing after getting several years of experience. I would like to move up at some point. What are your thoughts on this? Okay, so the thing is, you have to know first what these degrees mean, okay? First, the RHIA is the Registered Health Information Administrator. This is the bachelor's degree. Then you have the RHIT, which is the Registered Health Information Technician. Yes, Registered Health Information Technician. So with these two, you have to know that when you are getting the degrees, that employers will look at degree holders as the leadership. And people will say, well, no, my hospital only hires degree holders. That's not true. A lot of times they will say RHIA, RHIT, or CCS, right? So the thing with that is this. If you're getting a degree, it is because you want to be in that leadership position. You want that leadership role. Either you want to be in leadership, or you want to do education. You want to be an educator, or you want to be an auditor. I always tell people that it's funny with medical coding. When it comes to whether you should invest in a degree or just go with your certification, certifications hold just as much weight as the degrees do, believe it or not. And it depends on what you want to do, which is why it's important to understand what both of them stand for. So with the RHIT, yes, it is undergoing a change right now. And yes, it is meant to be phased out by 2027. At least that is what I have heard. I have posted the article several times about this. I've done an episode about it. But there were so many things up in the air. You know, it was hard to know at the time, but I did go over that. And so again, it really all depends on what you want to do. I tell people that if you don't know what this is, or what you want to do yet, start off with the certification. The certification is financially not as impactful as getting in the degree, okay? Because the degree is going to require more time, more money. And that's first of all. So is it going to be worth it in the long run? Again, we as certification holders can often make the same as people who have degrees. Now, I had a lady argue with me about this. She actually sent me a very angry email. And she was like, well, no, I make this amount and that amount. Technically, I make more than her. So it's just like, okay. And I only have my certification. I don't have a college degree. And I have known several degree holders who I still make more money than they do. So again, it really depends on where you are, what you're doing, how much experience you have. Having a degree does not necessarily mean more money. And a lot of times people will sell these things, right? Because we come from that time of, you got to have a degree, you got to have a degree. The funny thing about medical coding is that you don't have to have a degree in order to be financially successful in this field. You can have just your certification and you can do just as much. Even if you wanted to be in a leadership position, CCSs still do that, the Certified Coding Specialist, and that is the gold standard of medical coding credentials. And I say it is the gold standard because this means, if you have the certification, that you have mastered both the inpatient coding and the outpatient coding. And of course, there's the entry level, which is the CCA, or the Certified Coding Associate. This is a very good credential because this also says that you can code both inpatient and outpatient, but this says that you're in that entry level. Like basically, you're just starting brand new. I had the CCA for well over 10 years, and I stubbornly held on to it. I would probably still have it today if it weren't for all of you. So what happened with me is, when I had it, I was getting tired of hearing people say, well, the CCA this and the CCA that. I have trained doctors, I have trained degree holders, I have trained other medical coders with my CCA. I've done many things with my CCA, and I did it sometimes because I wanted to show people this is what a CCA is capable of. So with that being said, you can go either direction, either with AHIMA or AAPC, and get your certification and get started. Does that apply to new coders? Does what apply to new coders, Carla? Pamela says, I think we should do both because the workforce for remote coders is becoming very competitive. But if you're looking at the job listings, never once have I seen a job listing say candidate must have multiple credentials to get this job. Everybody's asking for one. And with the remote positions, when it comes to being a brand new coder and you're trying to go remote right away, the thing with going remote is this: COVID changed the landscape of how brand new medical coders get hired. All right. Before, you had to have 3 to 5 years experience. If you didn't have experience and you were trying to get a remote coding job right out of the gate, everybody turned you down. It was extremely rare to even get something like that. But when the pandemic hit, there was concessions made. Employers were willing to give brand new people a chance because they still need coders. Coders are still going to retire. They're still going to get sick, or they're still going to have to take time off. They're still going to get pregnant. And so they're going to have to take that time off. So because of that, they have to bring in new people. When they bring in new people, that's what they have to do with these new coders. So they were willing to try and train new people. Now, I do have, majority of my audience is with AAPC, and they were willing to hire on the CPCAs. So several of them got jobs at the beginning of the pandemic. So it's not impossible. You just have to be very persistent. And when now, because everybody's kind of going to a hybrid type schedule, like some people are still remote 100%. Some people are doing half time at the facility, half time at home. So where you apply matters. And because of that, they are willing to take those chances. However, you can't expect it right out of the gate. That's a selling point that a lot of these schools will use. Oh, do you know you can work remote? They don't tell you how hard it is to get that remote job, though. And so even though it may seem like it's impossible, it's not. I mean, there is that opportunity when you find it. Now, for everybody that's saying, well, I see that they want 3 to 5 years of experience, you still have to apply anyway. Because, as I've said many times this past week, I feel like I need to get a shirt that says employers are lazy. Let's be honest, they are. They are lazy because if they have a choice between somebody they have to train, somebody who's fresh out of school, versus somebody who has experience and has been a coder before, who do you think they're going to pick first? That's why they say these things. This is why I tell people, if you're going to get into the degree programs and you're going to get into that leadership position, then you need to start being part of the change. The landscape of how medical coders get hired changes at the top. It does not change at the bottom. There's nothing that we can do. It has everything to do with the leadership of that facility and their willingness to take on new people. But there's also the schools that are also at fault. When you have these schools that promise that you can learn a new career in 16 weeks and you can be on your way to earning this ridiculously high salary, guys, let's be realistic. It is not easy that they tell you that it is. Oh yeah, you use an encoder and it's already got the codes for you. You just have to check and make sure everything's okay. That's not always that easy. Okay, that's number one. Number two, when you are out there, you actually have to continue to learn. We have to know what doctors know while never having gone to medical school. That is the constant thing I say a lot on my channel. Because it's true. We have to be able to decipher all of this documentation. We have to be able to make sense out of it. Then we have to be able to query if we're seeing holes, like, is there something, could it be more clarified here? We have to be able to do that. And before you think, well, I'm a brand new coder, I don't know if I can do that. It took me a good 6 years before I even started to really understand, oh, okay, yeah, now I know what I'm doing. So it takes time, guys. It's not something that you're going to learn overnight. It's certainly not something that you can speed through in 16 weeks. Oh yeah, I can get this done in 16 weeks. Not even if you're a nurse. Because I will hear that from nurses. Oh yeah, you got half the battle. Yes, nurses have half the battle. They have their medical terminology and they have wonderful anatomy and patho too. Coding is completely different. And I have tutored nurses and they have said, Bleu, this is not anything like I expected. I thought this was going to be easier, and it's not. It doesn't make sense. It doesn't make sense if you have your nurse hat on. You have to take your nurse hat off and be able to think like a coder. Coders have to think differently. We think more logic. There's logic and there's abstract thinking going on when we are looking at these charts and the rules. So when you're reading those coding guidelines, oh yeah, you'll understand what I mean when you start reading those coding guidelines. It's not impossible though, folks. So if you're looking at these job listings and saying everybody wants experience, that's what I went through in the beginning myself. I said, oh, everybody wants experience, but you still have to apply anyway, regardless of whether you have experience or not, because they may be willing to take a chance on you. They're not going to open themselves up for that, oh yeah, we'll take on new coders, because they're going to get a bunch of people applying. And some people are going to be really good. And some people are going to be like, okay, I'm just here to collect a check and go home because they said this was an easy job. So that's what they're going to be looking for. So that's why they want to get quality people. And then if you have those persistent new people with no experience and they're still applying anyway, okay, you may not hear something from a lot of those people, but it's going to be a very good amount of people. If you're putting out a good amount of resumes and cover letters, they're going to call you back and say, okay, well, we'll go ahead and give you a test. If they give you a test, you got to make sure that you do really good on that test, because that's going to be their barometer to see do you even know what we are doing here? Do you understand what Profi means? Do you understand what inpatient coding means? Do you understand what outpatient coding means? And if you do, then okay, we can go ahead and give you a chance. There's people out there that are willing to take chances on people, because think about this. Every coder who has experience is already going to be working somewhere, right? Unless they want to move, then they'll be able to start applying for new jobs. But a lot of times these employers are going to be dealing with people who are either happy where they're at and they want specific things or whatever, and they'll move on if they don't get it. So they're, sometimes they get so desperate that they will take a chance on somebody new. But you have to put yourself in that position in order to get that chance. And a lot of times people will just look at the job listings and get so discouraged just from the job listings. Your secret weapon is your resume, and the other one is your cover letter. So the cover letter cannot be a regurgitation of your resume. It has to be why, your why. Why do you want to do this? What transferable skills are you bringing over that would help you to be a very good medical coder? So think about that. And then with this resume, it can't be like with all these filler words. It can't be bloated. It's got to be to the point. It's got to state the facts. So if you have those filler words in there, like a lot of like in addition to, but not limited to, that kind of words, you got to get them out of there, clean it up. And don't hire a professional resume writer, because I've seen some of the crap that comes out of those professional, so-called professional resume writers. If you're not a medical coder that's looking at this, now I'm not trying to drum up my own business or anything like that, trust me. I always tell you guys to write your own resumes. It's better when it comes from you guys. And I've done plenty of tip videos on how to write your resume. Doing this medical coding thing, you need a very strong resume. That's what's going to get your employer's attention, so that they'll give you a chance to show what you can do, you know. But again, if you're looking to get into the degree programs because you think it's going to make you more money, that's not true. You can make just as much money, or really good money, just being a medical coder, with being your certification, you know, getting a CCS, a CCA, or a CCSP, or a CPC, any of those. So you can take your pick and start there. But I always tell people, start there and start with one. All you need is one. You don't need all the so-called specialty certifications. There are certain specialty certifications that I do recommend, like the CDIP, or the one from ACTIS, okay? ACTIS is the Association for Clinical Documentation Integrity Specialists, I think, or Improvement. But anyway, they have their own CDI credentials. CDI is something completely different. It's Clinical Documentation Improvement, or Clinical Documentation Integrity. And they have these because it's more in depth than just your standard coding. You don't need to be certified on billing, because when you look at the job listings for medical billers, they're not asking for a billing certification. Okay, so a lot of those billing certifications that you see out there, they are a gimmick, and it's a waste of money. I mean, I'm being honest, it is. So people get them sometimes because they want them, and it's personal fulfillment, and I understand that. But at the end of the day, it's more money that you're going to be putting out. So I'm just trying to get you guys to look at the big picture. We are in an expensive field. This is not a cheap field. You have to be able to pay for your membership, right? For the association that you're with. AHIMA does not require this, but AAPC does, and they will revoke your credential if you do not pay for your membership. Okay. There's also your continuing education units. The more credentials you have after your name, the more continuing education units that you're going to have to come up with. So that's more money that you have to spend if you don't find them for free. Okay. So there's a lot of money that goes into this. And that's why I want to tell people, don't spend so much of your hard-earned money on unnecessary things that you don't need. Now, if it's for a class that you want to take so that you can get better, maybe it is like a reimbursement class that you want to take to help you, then that's totally fine. Or if it's for medical terminology, I always recommend that too. An anatomy class, that's even better, because understanding the body is really going to help you. It makes more sense when you're reading whatever specialty you're working in. It makes a lot more sense that way. Regina says, I think it's crazy when I see like 8 credentials behind somebody's name. And, you know, having multiple credentials does not necessarily mean that the person is completely knowledgeable in medical coding. I've seen people who are brand new to medical coding, and I'll know because they have an apprentice on their credentials, and they have a slew of them after their name. And when it comes down to it, an employer is going to want to see experience. And if they don't see experience and you have all of these credentials, what are you going to do when it's time to renew in the 2 years? Because you have 2 years to come up with these continuing education units. And if you haven't gotten a job yet, you don't have an employer to kind of help you with those. Some employers do help with continuing education units. My employer does one, continuing education unit for free per month. Great. I already have mine because I've done 2 online boot camps, one for inpatient coding and then the other one for CDI. And those were through HC Pro, and I do recommend those. So, that's something that, I want to pass on to you guys. Let me see. Did I miss any comments? I got a lot of blue hearts. I love the blue hearts. They look so happy. And then when I'm looking at the comments, I see all these little blue hearts everywhere. Carla says, hello, Blue. I'm hooked on your channel every day. Oh, thank you so much. I look forward to your videos. Hilda says, I'm new to Blue. Hi, Nikki. Let's see. I read Pamela's comments. Hey, Blue. Nay says, I'm glad I'm here and I'm getting my certification in an online program and I can't wait to get into the fields. That's wonderful. Carla says, does that apply to new medical coders being able to move up in the field with a CCS? Can you expand on your question, Carla? Because I'm kind of lost on your question. Does what apply to new coders? Nay says, that's all I see in the job requirements is 3 to 5 years. Pamela said, what are your thoughts on HFMA? What is HFMA? Hi, Letitia. And I read Regina's comment. Hi, Lauren. Hi, Elva. Hi, Caroline. I love all the blue hearts. Christina says, I may not be done with my program yet, but I have been thinking about looking at jobs now to get my foot in the door and start applying with what I've learned so far. Brenda, do all medical coders have to do op reports? No. Justin, it's been a while. Long time no see. Blue, if you get only one credential, which credential is best? And good evening, Brenda. Hi, Edel. My coffee is still warm. I just brewed it just before the show. All right. Yes, it is very time consuming to do all that studying. So, tell Miss Kathy I said hello, guy. All right. So, with Brenda's question, do all medical coders have to do op reports? No, it just depends on where you're working, what setting you're working in. If you're working in risk adjustment, you are only working with diagnosis coding. There is no op notes for that. There's no op note coding. If you are working in a clinic, you are going to be doing like procedures that are done in the clinic, but not op notes, not on full-on same-day surgery stuff. Same-day surgery stuff is the op notes. And guys, op notes is nothing to be scared of. A lot of people get scared of the op notes. But really, when it comes down to it, you're just coding what you see in the surgery. And there's things like the coding companion and the coder desk reference for procedures that help you to understand these procedures. And a lot of times the doctors will dictate their notes, and it'll be, okay, if you're looking at the dictated op note, and then you're looking at the procedure code that you think it could potentially be, and you read in the coder desk reference for procedures, and it matches up, that's how you know, okay, that's confirming what you already figured out. Op notes is not scary, guys. You just have to keep working with them. It's just a lot of words all in one sitting, but it's actually a lot of fun. Lauren says, OMG, I am taking patho and I'm ahead in class though. I have to study for intro to coding. Have a test due on Sunday. Eek! And Justin says, if you only get one credential, what credential would be the best? If you get certified through AHIMA or AAPC, you're good to go, right? All you need is either the CCS, which is the gold standard of medical coding credentials. I will keep saying that, because this one credential says you can code both inpatient and outpatient and that you've mastered it. So everybody asks for this one. A lot of employers ask for this because this person can go anywhere. If you're working in a hospital, this means that you can work in the outpatient setting and in the inpatient setting because you understand both. Again, the same thing with the CCA. Now, the CCA really needs a PR overhaul. A lot more people need to be talking more positively about it because it is a really good credential. Think about it. This is a 2-hour test, yes, but this person has to have enough knowledge in inpatient coding and in outpatient coding in order to pass this. Unlike the other credentials that are solely for outpatient, where you're only working with the CPT manual and of course the diagnosis book, but with the CCA, right, the same thing with the CCS, you have to know both inpatient and outpatient. You got to be able to use the CPT manual and the ICD-10 PCS manual. Both of these are the procedure books, inpatient and outpatient respectively. So, there's a lot to be said about the CCA. CCA is a great credential. And people shouldn't look down on it because it is a great credential. And like I said, I had it for many years. But I did get my CCSP, which is a Certified Coding Specialist physician-based. And this is the mastery of the outpatient setting. So that is, it's entirely up to you. Employers are going to be looking for what they look for. Sometimes you'll see in these job listings, though, CPC preferred. It doesn't mean that if you're a CCS or a CCA or a CCSP that you can't still apply. Preferred does not mean required. There's a difference there. And when it comes to, sometimes they'll say CPC, is because a person who is doing the hiring probably is a CPC themselves. So they know about what that credential is all about. Or they're trying to show support for their association, which to me, I never look at a person's credential. I always look at the caliber of the coder because the caliber of the coder is different. I've met degree holders who know a ton, and I've met degree holders who know very little, because with the degrees, it's more about the managerial side, the statistical side. It's more about that. That's where their learning is more concentrated towards. They're not meant to be medical coders. They are meant to do the managerial side of the house. That is majority of what they do. And sometimes you will see these employers ask the degree holders to still have a medical coding certification so that they know that that person who has a degree can also code as well. So it really all depends on you. But to me, my thing will always be with AHIMA. And nothing against AAPC. Obviously, I talk highly about both of them, but the CCS being the gold standard because it's the mastery of the inpatient and outpatient setting, that's what I would recommend. I would recommend the CCA as well, but I wish everyone else would get on board with that as well too, because so many times you see these employers, it's just like, really? You started off somewhere as well. And I will see sometimes employers, and one ad made me mad the other day when I saw it. It says, no CPCAs. Really? CPC preferred. You were a CPCA yourself at one time, ma'am or sir, and then you say no to do other ones? Really? Whatever. It's like, whatever. That's all I'm saying, is if you know a person can pass a assessment test, give them a chance. If they can't, then you didn't waste no time. No time, no money, nothing. You gave them a chance. That's what I'm saying. So these employers out there, if you are hesitant to hire somebody brand new, well, I don't want to have to train them and then they leave me. It doesn't necessarily mean just because somebody who is brand new gets with your company that they're going to just leave you when they get experience. If you mistreat them, they'll probably leave you. But a lot of times they want to make sure that the person is going to stay with them. Treat them right and they'll stay with you. But whatever, I don't know. All right. So where did I leave off? There's a conversation going back and forth. Okay, Tracy says, are there any differences in the ICD-10 and HCPCS books that you can buy through AAPC and AHIMA? I bought books through AAPC, but I think I want to get certified through AHIMA. Can I use them? Yes. If you look on, and I know you've been doing your research, which I am so glad you are. But if you look on the ahima.org website, it will give you a list of all of the allowable books, and I believe the AAPC diagnosis book is on there. Okay, the ICD-10-CM book from AAPC is on that approved list. I just don't feel like going through all of that stuff right now. But if you look on there, it will tell you. But I believe it is there. The one that we all have to have, whether you're with AAPC or AHIMA, is that CPT manual from the AMA, the professional edition. That's the standard across the board. But yes, all the publishers, the approved publishers, are all there. And you can also go to Optum360coding.com. They have, those are the Optum books, and they are approved to be used with AHIMA as well. So if you're interested in that, this is not an ad, but they're my favorite. Simone says they do it all the time. CPCA, we are limited to jobs. Regina says exactly. You're welcome, Tracy. Christina, they're having a conversation. So, but yes, so hopefully that answers. Does that answer your question, Tracy? About the degree versus the certification? Because I always tell people, start off with the certification. At least this way you'll know that you're not going to be 2 years invested into the game. You're not going to be 4 years invested into the game and then get out in the real world and decide, God, I hate this. Because I've known degree holders who say, if I would have known medical coding was like this, I would have never gotten into health information at all. And that's sad to me. I mean, it is sad because I think, you know, you invested all of this with the idea of what it was, but had you had a chance to try it out with like a certification that's just a few $1,000s to get, which is a fraction, right? Versus all the thousands of dollars you have to spend for the degree, you know, and then heaven forbid you go through one of these really quick programs and you spend $20,000 or $40,000 just for a certification. Don't do that. Don't do that. Trust me, go through the websites, AHIMA or AAPC, so that way you can prepare. But that would be better than going through one of these trade schools and going through these fast programs, and it's $10,000, $20,000, $30,000, $40,000 for a certification. Okay, good. I'm glad it answers. So yes, but that's what I tell people. Still apply anyway. Still apply anyway. Make sure you shine up your resume, because it is possible. We all went through it. All of us go through this. You do need to do networking. If you're in the associations, go to the chapter meetings, even the virtual ones, because then you're going to start making those connections. Get on LinkedIn. LinkedIn is a valuable resource. Now, trust me, I was resistant to get on to another website as well. But people kept asking me to get on LinkedIn. Now I have over 500 connections. So, but there's tons of resources there as well. Sometimes you'll see people on there that are upset because they can't find a job, or they're getting frustrated because they can't find a job. And then you'll see them, oh, I found a job. So you just have to keep going after it. Lauren says, I'm lucky enough to know people and research about it. Going through community college for a degree is cheaper. There you go. Pamela, I'm doing it backwards. I have my MBA and I'm starting my studying for the CCS because I want to be in leadership, and I discovered coding late in my career. A lot of people do that. Some people are in their 40s. Some people are in their 50s. And the lady that I knew when I finished school, 61, got her certification. She's still a coder today. And I've been a coder for over 10 years. So if she's still working, she's a very feisty woman. But yeah, she's full of dynamite, and she's just still going. And I think she was a nurse before, but she just has a love for it, and she never lost that drive to keep going. So I see another comment. How long? Oh, is Carissa says, how long did it take you to hear back from your first medical coding interview? I had one yesterday. I felt like it went well, but not sure how long it takes for the recruiter to call. Sometimes they'll call, sometimes they won't call. So don't get your heart set on it, is what I can tell you first. But the first time I started applying, I didn't hear nothing, right? And then it was about a couple of weeks later, I kept applying, and I finally got a test. I got a test, and I got it from this lady. And so then when we did our interview, she was like, Bleu, she's like, you passed this test. We don't get this test back normally with almost all of the answers correct. And I said, well, I did just finish school. And she goes, well, we can't bring you on board. She said, I tried to get them to let you come in and try and, you know, hire you, but they are very adamant they don't want anybody who has no experience. I go, really? She goes, Bleu, please come back. She didn't know me. I didn't know her, but she was like, Bleu, please come back. If you get experience, even just a few months, just come back and we will try to get you a position. She goes, because that's awesome. You did really good on this test. So I said, well, you could hire me. That would be awesome, you know. But she's like, you know, we have a thing at our facility. Okay. And so then I started still applying everywhere, and I got frustrated too. And I ended up going back to my school, and the principal of the school was like, I have a friend who has a temp agency, and I'm like, I don't want a temp job. You know, I want a coding job. I want to be a coder. And he's like, well, because you don't have experience, it's a little hard, right? And I said, yes. And he goes, so the more assignments you go on, the more your resume is going to fill up. Okay. And so when it fills up, then you'll have more experience and people are more likely to give you a chance. But because you're working for a temp agency, they're not going to really expect a lot out of you, but you can still learn while you're on the job. So I was like, okay. So I went and applied for the temp agency, and they said, okay, well, we'll call you. And of course, I've been hearing this, you know. It was about a week later that they called me and they said, well, we have a assignment, and it's going to be a 3-month assignment. And if they pick you, because they're picking they have 3 positions right now. But they're going to only pick one person at the end to stay on permanently. So I said, oh, okay. She goes, at least you get 3 months worth of experience, and it was cancer coding. Next to the ER, how much more scary can you get as your first job as a medical coder, right? And so I was like, okay, I'll do this. I didn't get picked, which was fine. And it worked out in the end because I got even more money when I went to my next assignment. Which when that assignment ended, they were like, it wasn't on technical ability, because they said I had technical ability. I don't know why, but the lady that was there, that was a supervisor, she was very mean, and I wouldn't have missed that job anyway. But I ended up getting another position because that temp agency had actually won a contract. And so they said, well, if you want this job, you have to move. I had to move 8 hours away from my home. And if you move on your own, but you will have a job. And it was paying very well. So I was like, okay, for somebody who had 3 months only of experience, I'll take it. I didn't want to take it. My mom was the one who forced me. She was like, no, you can't stay here, because if you stay here, you're not going to be able to find a job. It's going to be too hard for you. And I had still been working when I was looking for a job. I had still been working at the halfway house. I had been working at a concession stand. I had been doing all those things and everything that I was trying to hurry up and get away from. And so when I went out there, and I was out there and I was just learning, and they were asking me, because the first place they put me was in Profi Coding, and they said, we can't keep anybody in Profi. And so they go, do you want to try it? And I'm like, I don't know to be scared. Just give it to me, because I mean, that's all I can do. I mean, I'm not scared of anything. I don't know to be scared. I'm too new. And so they said, just tell me what to do. And I had a great teacher and she helped me through that time. And I was like, okay. And I was off and running. And then by the time you know it, I was knocking things down, because when you get into the Profi side, you're literally coding as the patient is in the hospital. And so you're just going through these encounters, and It was multi-specialty, so it wasn't just one specialty. It was everything: mom and baby, internal medicine, ICU, and psych. It was everything. So talk about a really good education. And that position led me here to where I am today. Now, when I applied for this hospital that I'm at now, I wanted it because it was closer to my hometown, but it wasn't quite in my hometown just yet. I still couldn't find anything in my hometown, but I had been applying. And this place is a lot closer to my hometown. And so I told my mom that I was going to keep applying, and I found a position at this hospital. I was like, I can do this. Let me just get in there. And so I had applied, and this position was a lower position. And so I was like, okay, anything, just let me in. So I did the resume, I did the cover letter, submitted my application, and then I waited. And then the job closed, so that they could review. And then it said that my thing was being forwarded on to HR. So I'm like, does this mean I'm going to get an interview? So then I got the call, hey, can we interview you? Can we set up an appointment? And I'm like, I'm out of town. And then she was like, oh, no, don't worry about that. We can do a phone interview. So I was like, okay. And this was long before Zoom, okay? There was no Zoom. There was none of that. It was all on the phone. And so I was like, okay, well, let me go ahead and try this. So we did this interview. They interviewed me over the phone. They gave me a test. And they were saying, well, if you answer all these questions. And so I had my books with me, and I was looking stuff up and giving them answers. And they were asking me what was the difference between 1995 guidelines for E&M, what is the difference between 1997 E&M guidelines. And I was able to give them all of these things. They were giving me anatomy questions, and I was just answering them. Boom, 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 boom. And so then I think everything's great. And so then at the end, she says, well, if you were selected, how soon could you start? I said, 2 weeks to the day I get the call. So she starts laughing. So she's like, okay, great. And I was in a panel interview, and they're all laughing, And they go, okay, well, if you are selected, you will get a call. So I was like, okay. So I'm thinking, I got this job. Everything's going great. I said, this is a wonderful interview. Cool. I didn't get the call. You want to talk about being ghosted and brokenhearted? I was like, oh my God. And I called my mom, and I'm crying. I'm like, I just wanted the job. And my mom was like, it's not your time yet. That position was not for you. So I'm like, okay. And moms have an amazing way of making you feel better. And so it was about a month or so later, a few weeks later, the same hospital opened up a position again, but it was for a higher position, more money. And I said, I'm going to do this. I'm going to apply again. And everybody told me, don't apply. They already didn't call you. No. My coworkers were telling me that, right? My mom, I called her up and I said, Mom, I'm going to apply again. She said, do it. Go for it. And so I said, okay. So I applied for it again. My coworker's like, don't do it, Bleu. They're not going to call you again. I said, what's the worst that's going to happen? They're going to see my name again, and they're going to see that I'm very persistent. I said, this was a good interview. I know it was. And I said, and I had it, but something had to have happened. So I applied. And then I wait. And then a couple of days later, I got the job offer. Didn't even have to interview again. I got the job offer. And so you want to talk about loud, screaming, excited, jumping up and down. First call was to my mom, and I got the job. And of course, she's proud. She's very happy for me. And, I need to stop because I'm going to get... That time was really hard for me, guys. And I still get emotional every time I talk about it. So I always try to talk really fast to the story, because it was all of that anxiety of just I just want to be at home with my mom. I just want to go back home, because while I had liked where I was living, it was not home. It was not home for me. And my mom was sick at the time, and I just wanted to be back over there with her. And that's all I wanted. And it was very hard to fly back and forth, but I was willing to do it. It was okay to do it. But I just wanted to be closer to my mom because my mom was sick. And so that was my why to get there. And so when I got this job, it was like the best thing. And I've been here ever since. And I can't talk about this no more because I'm just gonna start crying. But it's a good memory though. It's a good memory. All right. Okay. Lauren says, I was lucky too that my school helps you find a career-based jobs once you obtain your degree. That's great. Did I miss? Carissa says, okay, I just talked about that. Letitia, I love your channel. You gave us so much good information. Thank you. Hi, A. How do you look for a good medical coding school? Letitia asks. Justin says, good question, Letitia. I decided to go with AHIMA directly because they gave you an entire year for a certification, micro credential, that I hope I'll be able to put on my resume along with my degree. The two local medical coding places here, the university and the community college, were horrible, and the university guy sounded greedy and scam artisty, and the community college never answers phones. Miss Jones says, hi, Blue. Thank you for the blue heart. She says, what made you fall in love with medical coding? Justin says, AHIMA is expensive, though, around $4,000. I had to pay directly. What I bought was a 13-course medical coding bundle. Lauren says, in my community college is accredited through AHIMA, so I get the medical coding specialist certificate and the medical billing certificate, and they help with the AHIMA exams and finding jobs after. Do we need to send a thank you note after the interview? You can. Lauren says, and I have financial aid with grants, so that's what I did. Justin, it's harder than you think, Letitia. A lot of stuff to memorize. A year is barely enough time, I think. 2 would be better, and associates. And if you go with the associates, it has to be through an AHIMA approved college. CAHIM, actually. Simone, it's okay to get emotional. I know I struggle dealing with now all the rejections. It does. It really does. It messes with you a little bit. Thank you, Tracy. Christina, Letitia, when you are looking for programs, make sure anatomy and physio and medical terminology are all included. Thank you for the blue hearts, Elvia and Marissa. Thank you, A. Thank you. Guy says, Blue, haven't you heard? There's no crying in medical coding. I think it's more of the stories about it that will get you like that. Justin, I remember looking for a job in Springfield, Illinois during the 2008 recession. Dozens of applications, all rejections. I went crazy and left the state. Worked out for me though. Hi, Monica. Carissa, so I have my CPCA and CCS, and they even said they were impressed that because I was still in coding school. That's the reason I feel like I got it, but I don't want to get my hopes up. But you're welcome, Carissa. Yeah, I would just kind of sit tight, don't get impatient. If they told you something like that, I mean, obviously that's a good thing, but you don't want to put too many eggs in one basket. Okay, keep applying. That's what I gotta tell you, is to keep applying. And that's really great that you have the CPCA and the CCS, because you can go anywhere. You can go inpatient or outpatient. So that really does open up a lot of doors for you. If you have just the outpatient certifications, obviously you're kind of limited to the outpatient setting. But sometimes with that, sometimes employers will train you for the inpatient side. I've seen CPCs There's in fact a CPCA who watches my channel who told me that she is getting inpatient training as we speak. So, Justin says CPCA and CCS is impressive, but goodness, you're going to have to juggle 2 membership fees and 2 organizations and 2 continuing education degrees. But to, who was it that asked me? What made me fall in love with it? Miss Joan, what made you fall in love with medical coding? So with my thing with medical coding, oh, you're welcome, Elvia. Thank you for the blue hearts. How did I do it? Well, I know how, right? So after I got the job here, my mom passed away, which is why but when I kind of threw myself into medical coding because I was just trying to keep my head above water. I mean, honestly, when you go through something like that, and I had moved twice in the span of 10 months, 8 months, 10 months. And so I was doing a lot of moving at the time, and of course going through that and just trying to stay focused and stay concentrated. And this was sort of my escape. Medical coding became an escape for me. And it became like, okay, if I concentrate on this, I can just sort of like forget about everything else for these 8 hours that I'm here. And then I have the rest of the day to do all these other things. But it became of, well, let me learn about this. And then I started reading. And when I started reading, I was like, oh, this is interesting. And so then I said, well, if I start reading this book about coding, I might get a little bit faster. So I was still doing Profi Coding when I got here, because that was why they had pulled me in, because they said, well, we liked you right away because you do Profi Coding. And so being there and having the experience with mom and baby, because where I came from, a lot of babies were being born. Here, there's a lot of babies being born as well. And so I was able to get through those really quickly, where the 2 girls that were already there, it was not very easy for them. So I was trying to, just do my own thing and concentrate on mom and baby and trying to get all of those things going. And as time went on, it just became more interesting. And then I had an opportunity to become a volunteer with AHIMA. And AHIMA actually flew me up to the headquarters, and I took part in a project that they had. And so that sort of gave me that, wow, I get to experience this, and I get to be in Chicago, and I get to go to our Graceland, right? I'm a huge Elvis fan, so I get to go there and spend time up there at the headquarters and see everything where AHIMA starts, and where it is, and it was nice to have that experience and be a part of the organization. And so it was just like, oh, wow, this is really it, And then in 2014, when the changeover was going to start, because October 2015 was the beginning of ICD-10, right? So we had been training a year beforehand. Well, in 2014, I decided to attend my first medical coding conference. So I went to the AHIMA conference, and that was out in San Diego that year. And I had a huge experience there because they had Casey and the Sunshine Band, they had Bleu, and then I got to go to all of these classes about medical coding, and then the ICD-10 changeover and everything. And so it was just a fun time of learning. And so as I start going through all these things, and I'm going through the exhibit hall, I'm getting all these things, and all I could think of was, oh, I get to take all this information back to my coworkers because I know something that it can help them to learn. So I was just like, oh, and plus everything, all the swag stuff that you get, all the fun, cool things that you get from conference. So, so I went and brought all this stuff back, and I started talking about all the things that I had learned. And so everybody was like, you went? And they go, well, who paid for it? I go, I did, because it's an investment in my own knowledge. And that was what I was looking at it as. And I got administrative leave to go there. So I didn't even have to use my own leave, which was awesome because they said that is your place of work when you are out there. And so I was like, they go, as long as you go to a conference, you know, you paid for it, we'll give you the time. So I'm like, that's perfect. That's a nice trade, you know. So, and I had been doing that every year since. And so the love started to evolve then. But it didn't really, I mean, it kicked in then. And it was just like, I would get so excited to start going to work. And it had nothing to do with anything other than I couldn't wait to get started on work, because then I started to think, now I understand this, so I'm going to go faster at this. So now I can start knocking down a lot of my backlog, and now I can start knocking down a lot of these other things, and it's just like, I got it. So that's when it started to evolve, and that's when it started to turn into, this is not work anymore. If I'm this excited about it, this is a passion. This is not work anymore. And then 2015, before October, it was earlier that year, we had moved into a new hospital because we got a brand new hospital. And they had housed us away from the hospital itself because there was no room in it. It was too small. And it had been there since like the 50s. And so the population has outgrown it. And so they never had any room for us. So we were always in just an ancillary building. And then when they built up the new hospital, we got to move in. Well, now you're dangling something else fun in front of me now. Now I have a new challenge, and that is training providers and actually having that one-on-one, because I had not had that one-on-one. I'd only seen them on email. That was it. And sometimes you get responses to queries and sometimes you don't. So that was a new challenge, and that's what made it even more fun. And it's the love just kept going from there, because now it wasn't just, this is my clinic. It's, these are my providers, and I get to take care of them, and I get to help them develop and get better with their documentation. And then when I had providers move on to other facilities, and then I get calls from them later on, and they say, thank you, Bleu, for teaching me this, because I don't have a coder now, and I'm just glad that I know what I'm doing. My partners don't know, but I know, and I'm able to pass this on to them. And that's like the best feeling ever. And so then knowing that there's other coders out there that could use help, that could use somebody to ask questions to, that was like, okay, I can do that. And that's when the idea for YouTube came on. And so I was like, that was a few years after that, but it was just an inspiration. One day I was walking the track with a friend, and she was like, you really helped me, and you should be a teacher. And I said, I should go on YouTube. And that was how it happened. That was how it happened. So let's see. Caroline says, just a question. I'm thinking about going to get my certified tumor registry course and become a certified tumor registrar because it is very close to my heart, but also to get my coding credential. There's not a lot out there about certified tumor registrar. Since you coded for cancer, any info or suggestions on this particular field? Yes, absolutely. This is one of those specialty ones that I will recommend. The tumor registrar, yes, because there's rules on these facilities, and you have to have a tumor registrar. You have to be a tumor registrar, certified tumor registrar. So you do have to have this. So I do recommend it because it is looked for. I mean, people do look for it. It takes a very special coder to be able to do this kind of coding. It is different. It's not like injury coding. It's not like mom and baby. This is something completely different. When I did it and I was learning it brand new, right out of school, I didn't know that you could have a certain cancer in a different body part. Like it could be kidney cancer in your liver. I didn't know that. And I was just like, really? I was like, that's weird. And then, so they were explaining it to me, like how it goes. And I'm like, oh wow. So then you start learning about all these things and these treatments and all the things that they do. And so I was just like fascinated. And so it does take a lot. I have helped people with it before. And I'll do it, but again, my heart is with ortho. Now that I'm in ortho now, but back then it was just like, yeah, it's very detailed, like all coding, but I think more so with that. But yes, I do absolutely recommend being a tumor registrar, and it is worthwhile position to get. Justin says, CTR, I've heard about that with AHIMA textbooks, and I've seen a company out there that hires them. It's much more specialized. Don't know much about it though. Not every hospital has that job. I've looked and I've only seen a few CTRs. Christina says, at Caroline, if you contact the Children's Tumor Foundation, maybe they will be able to help you get a job with tumor registry. And I have contact with someone there too. So if you want her email, just ask, oh, that's nice. But yeah, so I mean, they are out there. The positions are out there. And with that, it's different from coding, right? Because for certain positions, they have to have somebody in-house that has that certification. So it does make you a little bit more in demand, even though you may not see a lot of them. It doesn't mean that they're not out there. So if that is close to your heart, that's what you want to do. There's nothing better than that. If it's something that is close to your heart, that means that you're going to do it with a passion. And that's going to show in your work. It's going to show in your resume. It's going to show in your cover letter. It's going to show in all of these things. So I would do that. I would jump into something like that with both feet, if that is what you want to do, you know. And yes, Justin, apparently there are other types of registrars too, like trauma registrars. Yes, there are. So it does get a little bit more detailed. It helps when the person is specialized, because then they know they have advanced knowledge of that subject. Because sometimes people don't know exactly how to get that advanced knowledge. And to get that advanced knowledge, it takes patience with yourself to be able to get that. I didn't always have, that advanced knowledge with ortho. That took time. I've been in ortho for many years. But I had been in it with ICD-9 and then into the ICD-10. And ICD-10, I happened to go through 2 simultaneous programs at the same time. My employer did one, and then I went through a course at home. So what my employer lacked, if they lacked anything, it was picked up on the other side at my at-home course. And whatever they missed, my employer got. So I got double the training, but it did help me, because I was able to understand, okay, I understand injuries a little bit better than the average person at my work, because it was just like, okay, I get sequela. And they were like, I don't understand that. Like, what is that? So I have to explain it. And, once you get it, then you get it. There is a lot to it. But getting into this is a commitment. It is a commitment, folks. But it will pay itself off. Like I said, I don't work anymore. This is not work to me. I work a 40-hour work week job, yes, but I come home and I have my Patreon channel, I have my YouTube channel, and I do tutoring, and I do resume review. And so it's just, it's constant. It is literally constant. But I learned that this month is self-care month. So they said to make sure that you do something nice for yourself. I always try to make sure that I schedule time, even for myself, for my own downtime, where I'm not doing anything, where I'm not, answering things on the channel. I'm not answering things on anywhere, because I need time to just take a time out. That's what you have to do, because you have to be able to take care of yourself. Is that oxygen? You got to put the oxygen mask on yourself before you can help anybody else. It's that same way. So if you're out there and you're being hard on yourself because you don't think you've been studying hard enough, or you've been studying too hard, take a break. That's all I got to say, because learning all of this, and I really got to hand it to Tracy, because she is out there doing her research. She's actually looking stuff up. She's taking the time to go through all these things, like I always tell you guys to do, because there can be things that I can say, but it doesn't necessarily, it's not going to necessarily make sense until you actually take the time to look it up yourself too. And so then when you do, then it's just like, oh, okay, now I get it. Because again, I can say it, but it may not make a lot of sense. So it's great. It's great when I see people that are doing their research, because there may be something that you see that you want to try, or you want to do, that I wouldn't have known about. So there's always that. But yes, getting into this is a commitment, and it is, I don't know. And plus I love books. You gotta love books too. You can't hate the books. Good evening, NC. You guys have been such an awesome audience tonight. Lauren, it takes time to resonate with you. That's why I love the day in the life videos and learning. Yes. But once you get it, you get it. I mean, it'll be like, okay, now I get what she's saying. And people tell me, you're such a nerd. I get that a lot. I even get it at work. And somebody told me yesterday to get a life, which I thought was funny too, because it's just like, this is what I enjoy. You got to enjoy what you do. I enjoy what I do. When I see things, when I'm looking at my doc's work, and I see like their stories, like they'll say like what happened to the patient, and then the level of detail, and I'm sitting there and I'm laughing because I'm like, yes, this is awesome. This is awesome. And I get to see that. I get to see that develop. And I see documentation that goes from barely any detail to now we got detail. Now we know what's going on, and it's amazing. It is amazing to have that. It really is. Jackie says, can you tell me about your Patreon channel? So with Patreon is a lot like YouTube, but on Patreon, you pay to support the creator, which would be me. There's me and tons of other creators on Patreon, and there's no commercials. So all the videos that are there are no commercials. And I know you guys hate commercials. Even when I watch my favorite YouTubers, I hate the commercials too. But with the commercials, you can always skip them, right? You can always skip them. The thing that they say is, as long as you continue to watch after you skipped, that's the thing. You could skip them all day long and you still support the creator. But continuing to watch is the key. And so that's the great thing about it. But on Patreon, I share exercises. I do exercises. I come up with diagnosis coding exercises or procedures for inpatient or outpatient. I come up with critical thinking exercises, and basically I'll write out a scenario, and then I'll say, what do you see here? The diagnosis codes, the procedure codes, any of those things, the levels, the E&M levels that you may see. And it's called critical thinking. And what I have that I offer on a recurring basis is those 10-question quizzes, the crossword puzzles. I make crossword puzzles, right? And it's to help you with medical terminology. It's to help you with anatomy, because of course with the clues and everything. So it is a lot of fun. It's a good way to engage your brain to remember things. And right now the minimum pledge is $10 per month. You don't even have to keep, you don't have to be like a recurring thing. You could just pay $10 once and then get access to the tons and tons of puzzles and everything else like that, the quizzes and everything that I have on there. And they do have the answers. And one time I did miss one. I was like, she's like, where is it? I was like, oh man, I missed uploading it. So I uploaded the answer key. And then I explained it. And then recently I had posted the slide deck that I did for injury coding. So I was asked a couple of months ago by the area president of an AAPC local chapter, and they had asked if I would do a presentation. So I was like, yeah, I mean, that was my first professional speaking engagement. So I shared the slide deck that I did about the life cycle of injury diagnosis coding with my Patreon audience. And I also read it. So that way, and I talked it through so that way that they can understand what happens. But that's one of the things that I do there. And I have another one that's coming out for podiatry coding. And I have another idea that's coming up for E&M with like the modifiers and everything, and deciding when to use modifier 24, when to use modifier 25, modifier 57. So it goes more into depth there. And I do a lot of that kind of specialty stuff on Patreon because when I was trying to do it on YouTube, it wasn't really received very well. And I know maybe it was because the channel was smaller back then, but I did get a lot of just like people weren't watching, they weren't doing a lot of those things, and so it's just like, okay, then I'm basically wasting my time. So that's why I started putting it all on Patreon. That's why I do it there, and plus people are able to ask questions back and forth, whatever. And then of course I talk about myself. I've done weekly updates. I talk about stories that happen at work, personal stories that I don't share on YouTube. I share a lot with you guys here on YouTube. Yes, you guys know a lot. But with Patreon, it's a little bit more because I feel like, they're taking the time to be there with me and support me. And with the money that I get from my Patreon channel, what I do with that is I pay for my continuing education. I pay for books. A lot of the books that I got on sale through Optum 360 Coding, and which is nice because I'm able to take what I learned from those books and pass it on to you guys, or pass it on to my Patreon audience. So I think it does help, and I've had many people tell me that it's helped them when they were studying for their exams, and they spend a couple of months with me or a month with me, and then that's it. And I appreciate everybody. I appreciate every dollar I get. But I created it because somebody asked me to do it. I never thought about it. I never said, oh, I want to do this because I want to make all this. No. It was just like, okay, well, I'll do this. And then, well, what am I going to do on this other channel? I can't just be like episodes. People are going to get tired of me. So that's why I started to do the puzzles. And I was like, okay, I can create puzzles. And people love them. I mean, so at least I think so. At least I hope so. Or I'll do other worksheets as well. So, let's see. I got a lot of comments coming in. Hi, NC. Let's see. Michelle says, I would like information on that too. Michelle says, sorry, I missed that part. Did you say you break down the medical report? So what I do is I write out a scenario, like an encounter note, and then I'll talk about it. On some I do that, some I just post the answer depending on what it is. But I have retrospectively gone back on some of the older ones and explained my thought process, and those videos are up on Patreon. Michelle says, that's the part that worries me the most when taking the CCS exam. Marissa says, I just joined. There's good content there. Thank you so much. I appreciate all the work that goes into it. Thanks. Thank you so much. Caroline says, it's close to my heart because my mom died of cancer when I was only 6 years old. Oh my goodness. And my dad has cancer 3 times and beat it. And they also thought I had leukemia. I have 3. Oh my goodness. Well, my heart is definitely with you. Letitia says, APC program is designed to be completed within 4 months with an additional 2 months grace period. Is that enough time to learn, or is it a fast-paced program? It depends on how fast you learn, okay? It is fast. 6 months is fast. Keep in mind that, even though you completed the program, it's on you to schedule the exam, okay? When you're ready to schedule the exam, getting through the program is not the same as, okay, you got to take the exam now, okay? You can get through in 6 months and still continue to study an additional 3 months so that you make it a manageable 9 months. Okay, I say minimum 9 months. 9 months, 12 months, or 18 months to learn medical coding. Then you can take your certification exam. So while you're going to be very fast through that program, if you're on it, you're on it. Some people, it's just too much. So that's why I always say 9 months. But if you're going to go through in 6 months, you're going to go through 6 months. 4 months is very fast. That is very fast. It's a lot to learn in 4 months. Great info tonight. Thank you. Thank you so much, Gladys. Thank you. Thank you. Do you have a video that explains about risk adjustment? How is it? How to do it? I think I do. Laura says, never. I will never get tired of you and learning from you. Oh, thank you so much. I always wonder that. Like, you know, I try to be creative. I try to think of like, okay, I try to look back on the comments and get inspiration for ideas for shows and things like that. Because I was gonna talk about MUEs tonight, but I don't think I'm gonna have time because we're already hitting almost to 9 o'clock. Because I'm in the Central Standard Time, but I'll have to do that on another episode. But when you have that drive to kind of help people, you know, it helps. At least I think so anyway. You're welcome, Michelle. And thank you all for the blue hearts. How do you sign up for Patreon? You go to patreon.com//medicalcodingwithbleu, and Bleu is BLEU. The address for that is in the description box of this video, or I could just put it here, thinking about it. And you guys are under no obligation to stay more than a month, but when you sign up, it will charge you recurrently every month on the 1st, so you have time to cancel it or, you know, keep going with it, whatever. I appreciate it all. Yes, so that's how we've been doing it, Caroline. Is I've been the middleman for connections with Christina. So if you will email me at medicalcodingwithbleu@gmail.com, so I can get you that information. Or do I have your email already? I don't think I have your email, do I? But yeah, just email me and I can email you her information. But yes, so, but that's what I do. And that's my story. And I hope it answered that question about certification or degree. I always tell people, if you don't know, if you're not sure, start off with the certification. Because at least this way you didn't invest so much to get into it if you end up not liking it. Or if you find that it's not for you. Because it's not for everybody. It's a lot of reading, a lot of studying. If you don't mind that, then you're okay. But, you know, it really all depends on you. So, I will go ahead and close it up. Thank you guys so much. You guys have been a very awesome audience tonight. I really appreciate it, especially after today. But this has been a very good chat. I've enjoyed this episode. I see a comment coming in. Tracy, can I learn and study with the 2018 edition books and then get the updated books when I go to test? There's been a few updates since 2018. Right now, if you're just gonna study right now, I mean, yeah, you can use those. However, Optum 360 Coding right now has the 2021 editions for 80% off. 80% off. I just ordered a ICD-10 PCS book and it came out to $24. So, I mean, they have a really good sale right now. So if you go to Optum360coding.com, again, 80% off. And you can check it out. Good night, Lauren. And I'll leave the address here in the box. They are at 7:30 p.m. Central Standard Time. I was just a little late today because I had to make sure that they had my coffee. But you're welcome, Marissa. But yes, there, if you check out Optum360coding.com and you go to medical coding specialty and you go down, you click there and you go down to best deals, it will lead you to the sale and you can get a really good deal on books. But if you want to use 2018 right now to study, it's okay, but they're a little outdated because there's been quite a few updates since then, especially with E&M. E&M has updated significantly since 2018, so something to think about. You're welcome, and thanks again, guys. If you haven't had a chance to like this video, please like this video, share if this video helped you, subscribe if you haven't already, and I will see y'all next time. Bye.